Okay, we will start, right? So basically this is an extension of the first lecture you had on standard precautions. So today we are going to cover biosafety and biomedical waste management. Okay. So myself, Dr. Shreeraj Talwadekar, I am assistant professor in microbiology and also the infection control officer, that is ICO of KEMHICC, that is KEM Hospital Infection Control Committee. Since you have already got a welcome into this first year and this college, hopefully the audio plays. I have a song to welcome all you guys, right?
बचना ऐ हसीनो तो मैं आ गया ए बचना ऐ हसीनो.
I'll play it again.
बचना ऐ हसीनो तो मैं आ गया ए बचना ऐ हसीनो बचना.
Okay, so who is saying that? Okay, leave this slide. Who is saying that song, Bachna Hai Hasino? It's not Rishi Kapoor, it's the pathogens in our hospitals. Okay, since you have taken MBBS, you have to be careful, and that doesn't mean that the दीवानों should not take care. सिर्फ हसीनों को नहीं बचना है, दीवानों को भी बचना है. इतने नए नए हसीन और दीवाने आए हैं. Okay, so you have to realize that everywhere you go, especially when your clinic starts from next year, you will find pathogens and you have to be careful. Now everyone identified this person. Who is this? Thanos. Is he the most deadliest person in this world or in this universe? No? Then who is? With one snap he destroyed half of the planet, half of the entire universe. He is not that dangerous? Then who is the most dangerous? This is real life, right? Who is more dangerous in real life? See this person. Coughing without covering mouth and nose. You can see this. So many particles are being released while a person coughs or sneezes, even talks. Understood? So this is something which you have to take care of. What this means is, you can see this, the picture on the right of screen. This is infrared camera photo when a person sneezes. So suppose this person is positive for some disease. What will happen? These particles are released in the environment. Do you see these particles? No, generally you don't see them, right? So you need a infrared camera. You can see some of the particles. These are bigger and they fall down immediately. These are known as droplets. And some of the particles, the red ones, these are much smaller particles. They do not fall on the surfaces immediately. They tend to remain suspended in the air for a long time. These are smaller particles known as droplet nuclei or aerosols. So certain diseases spread via droplet. Certain diseases spread via droplet nuclei or aerosols. Why you should know that? Because you are going to encounter such infections whenever you work in the clinical settings, and the methods of prevention against them are different. So like I said, the bigger particles, which are the droplets, where will they fall? They will fall on the surfaces. Suppose I am a patient, and classical example is COVID-19. Everyone knows COVID-19. Everyone knows SARS-CoV. When did it start? SARS-CoV, 2003. Okay. SARS-CoV-2, 2019. First case somewhere around November, December in China, 2019. So SARS-CoV, MERS-CoV, there is another coronavirus known as Middle Eastern Respiratory Syndrome coronavirus, MERS-CoV, 2013. And then in 2019 came SARS-CoV-2. It is similar to SARS-CoV, hence it was named as SARS-CoV-2. Previously named as Wuhan virus, then novel coronavirus, nCoV, and then later called as SARS-CoV-2. So these and many other infections, how do they spread? They spread by these droplets. So if a person is positive for that infection, coughs or sneezes, what happens? These droplets, they are larger then 5 microns, and they fall on the surfaces. And when you touch these surfaces, and intact skin is a barrier to infection, then you rub your eyes, pick your nose, these are the mucous membranes. Then the virus will enter. Understood? Mucous membranes don't have that much of defenses. So they will not go through your intact skin, but they will go through your mucous membranes, as long as the virus is viable. Plus, they do not travel more than 6 feet. You can see they are larger droplets. They have fallen on the ground or surfaces. Hence, they do not travel more than 6 feet. That is why if you maintain a distance of more than 6 feet, which is most ideal, or at least 3 feet, then you are likely to not get infected. That is why we advise social distancing. Abhi samajh gaye why hand hygiene and social distancing was provocated during COVID? You could have thought, na re, ye to respiratory virus hai, ye to सांस से जाएगा, तो क्या फायदा है hand hygiene का या social distancing का? So this is the reason. When it falls on the surfaces, you touch and immediately do a hand hygiene like that day we learned. Then that virus or any pathogen which is there will not survive and not transmit. So for droplet precautions, what is needed is hand hygiene and social distancing. Understood? The infections which spread by droplets. However, there are certain infections very important in our country is tuberculosis. Have you heard about tuberculosis? Right? So these spread by tuberculosis spreads via droplet nuclei or aerosols. These are much smaller particles, less than 0.5 micron in size, and they can remain suspended in the air for a long time. They can travel great distances. If I am a TB positive patient, I cough, the particles can reach the last person, the backbenchers as well. Understood? That is how it can travel. So will social distancing help? No. Will hand hygiene help? It is not spreading by touch. It is directly being inhaled by the person. Understood? So hand hygiene will not help. So whenever you are working in a condition where there are TB patients or you are doing a procedure which generates aerosols, you need ventilation more than social distancing and hand hygiene. Do you get this? These are known as airborne precautions. And that was droplet or droplet contact precautions, social distancing and hand hygiene. Airborne precautions include ventilation, so that a person has coughed now and suppose you keep both the windows open, cross ventilation, natural ventilation. Then what will happen? The particles will be carried away and go in the atmosphere and get diluted. No one will get infection. Or you have a mechanical ventilation, artificial ventilation, which is pushing filtered air into the hall, lecture theatre. Understood? So that those particles go into the filter, get trapped, and whatever comes is the fresh air, so that no one gets the infection. So main control of airborne infection will be ventilation and N95 respirator. Last time we all saw what was an N95 respirator, which will get snugly fit to your nose and mouth, so that none of the particles enter. About 95% of the particles will be stopped or filtered out, so that you don't get the tuberculosis. समझ रहे हो difference? समझ गए दोनों? When do we need droplet contact precautions? Whenever you are thinking of certain diseases like COVID, etc. And if you are handling the patient suspected of tuberculosis or doing certain procedures, then you need an N95 and good ventilation. This is very important because you will encounter lots of such diseases. Do you know this? What is this? SARS-CoV-2 virus or COVID-19 virus. Do you know who this is? This is the whistleblower of China. He was a doctor. He first saw that pneumonia cases and he thought that this is not the normal pneumonia they have been seeing since last few years. He thought that this is something different. It reminded him of SARS-CoV-1 in 2003. So he kind of tried to warn the authorities, but he was kidnapped. China hai wo, kuch bhi kar sakta hai. So he went missing, and in the end he succumbed to COVID-19. Okay, he's the whistleblower. And you can see this even in our state, second wave, how many doctors died? 573. This is still an old number. It went above 800,000. Understood? So you have to be very careful. You cannot take it this lightly. Even in developed countries like Europe, these are European numbers. 17,000 healthcare workers died of SARS-CoV-2 in 2021. Imagine. So this is not to scare you, but to make you aware of the things that what you will face. And this is not the end of it. This is not the only pandemic or epidemic you are going to face. Have you heard about Nipah? So currently you are having 2 cases in Kerala. So all these viral diseases and other emerging and re-emerging diseases are going to keep on coming because of the increasing population, because of increasing use of antibiotics, because of increasing proximity to the wildlife. Understood? So that these things are going to come. So that is why you should always be prepared for the next kind of epidemic or pandemic. So healthcare workers are 12 times at more risk than the general population to get SARS-CoV-2. This has been shown by many articles. Why? Because they are the first persons to see the patients. Any person will come to the hospital once they get the cough and cold. Understood? So healthcare workers have 12 times more risk of acquiring not just COVID but other infections as well. Is it clear? So you have to realize that you will always, starting from second year onwards, you will always be at a higher risk of certain infections than the general community. That is why these precautions are necessary. You don't take it lightly. There is no use of crying later. Understood? So this is some of the photos of COVID warriors, frontline workers who lost their lives. This is from India. This, I guess what you were doing back then? 11th standard or 12th? 10th standard. Okay, so probably you have not seen this side of things. You are in the lockdown, but it was absolute chaos in the healthcare setup. Okay, so people were working day and night and all that stuff. You had lockdown, you did not get PPE kits initially, you could not get N95 respirators initially and all that, but thankfully we tided over it. But you have to be prepared for the next thing. It cannot be a knee-jerk reflex. Always what we see when things come, अरे जब आएगा तब देख लेंगे, and then we land up in a soup. We have to be prepared and not give a knee-jerk reflex to whatever comes. Is it clear? So now you as medical students should be prepared for the next pandemic or epidemic which may come. Is it clear? So you need to know about all this. What happened before COVID-19? When we used to keep such lectures, अरे यार क्या सब मालूम है हमको, चल अपने बाप को मत सिखा. This is what the physicians and surgeons used to tell us. Barabar. And then COVID came, then they were telling us, keep session for how to wear PPE, how to do hand hygiene, etc., how to wear N95. So you have to realize that you have to give it importance before the pandemic strikes you, or before any epidemic strikes you, or before any infectious disease strikes you, especially MDR-TB. Have you heard this term? Multi-drug resistant tuberculosis. It is a very deadly disease and it was always there even before COVID. And many of the healthcare workers have got multi-drug resistant tuberculosis in the past because they did not take certain precautions. And then you have to take medicines for as high as 18 to 24 months. And these are very strong medicines, drugs. Understood? With many side effects. And if there is something known as XDR-TB, all this will come to you in second year, that takes 36 months of treatment. Imagine. So do you want to spend 5 seconds more checking that your N95 is working properly, or you want to get the disease and take the medicines later? Understood? So prevention is always better than cure. These are certain references. I'm not going in detail. There are many instances in which it is proven that healthcare workers are at increased risk of infections. Understood? So you need to realize when you go in the clinical area, you are surrounded by potential pathogens. I say andar guso. Understood? Now this is a non-clinical area. You understand the difference between clinical and non-clinical area? This is a lecture theatre, so it's a non-clinical area. Moment you step into OPDs, wards, ICUs, those become clinical areas. So there you will find lots of pathogens and you have to be careful. Understood? So what do you mean by biohazard? It is a agent of biological origin and has the capacity to produce damaging effects on humans. It is a hazard and biological in nature. Examples are microorganisms, just like I said, tuberculosis, SARS-CoV-2, Staphylococcus aureus. You have heard all this? Staphylococcus aureus suna hai na? Or not? Okay, you will get to know all this. Then toxins and allergens derived from such organisms and genetically engineered biological substances. So there is a possibility that we cannot say for sure, but there is a possibility that SARS-CoV-2 was genetically engineered. That is known as bioterrorism. So there is no proof of it yet, but there is a high chance that it was produced in a lab. So this is biohazard. What do we mean by biosafety? Safety from biological hazards. That is the theory of it, but more important is practice. सिर्फ theoretical knowledge होके फायदा नहीं है, practice करना important है. Whatever you learn today, you have to implement starting from your second year when you step into the clinical area. So good practices will reduce the risk of biohazardous substances. What is risk? Risk क्या है? Risk है तो इश्क है. क्या है risk? What is risk? So risk is the probability of a harmful health effect as a result of exposure to a hazardous substance. So basically risk is a function of hazard and exposure. Understood? Like what is the risk of acquiring tuberculosis in this room? Unless any one of you is having tuberculosis right now, active tuberculosis, almost zero. Understood? So there is no hazard. So risk is zero. But when you step into the clinical area, there will be hazardous organisms around you. So hazard will be there. So how do you mitigate the risk? Decrease the exposure. Understood? So hazard, biohazard will always be a part of your life because you have chosen this field. Please understand that. Can a soldier on the border say कि मुझे गोली लगेगा तो मैं जाता ही नहीं हूँ border पे? Because गोली is a hazard, I can die. He or she cannot say that, right? Similarly, you cannot say that there is hazard around. I will not enter this ward or I will not enter this ICU. But what you can reduce is the exposure. Understood? That is what you have to focus on. Hazard will always be there. You have to focus on reducing the exposure, your exposure to the pathogen. Simple example, shark is a potential hazard. Shark can attack you. Suppose you are seeing at the shark in an aquarium behind a glass. What is the exposure? Zero. So what is the risk? Zero. Understood? The minute you are swimming in the ocean with the shark, what is the risk? Risk has increased. Okay, so risk is the function of hazard and exposure. Hazard will always be there. You focus on the reducing the exposure. However, there is one more parameter, that is vulnerability. Shark is there in the water. You are there in the ocean with your friend. Your friend is a champion swimmer. You cannot swim. Who is at more risk? You. Understood? Because you are more vulnerable. So always remember the factor of vulnerability. So risk is equal to hazard into exposure into vulnerability. Why is this important? Why are we discussing this? We saw in COVID that certain people who were vulnerable, they were not given certain duties. So तभी रोने का नहीं. Pregnant females or diabetics, elderly, they were not given frontline COVID duties. They were given certain other duties. तो अपने लड़के क्या रोते हैं? अरे लड़की है इसको इसलिए दिया नहीं, इसको कोविड में डाला नहीं. That is not true. Understood? There may be people who are vulnerable to infection, so there are certain procedures which they will not do. Is it clear? So, when you become senior, it is your responsibility to keep the vulnerable away from infections, to reduce the exposure of your juniors. Understood? Senior means not second year MBBS, third year MBBS. Senior means when you will be in a managerial position. You have to ensure that your vulnerable are protected. You reduce the exposure of your whoever you are managing. So which of these two specimens do you think is a greater risk? One is urine and one is blood. What do you think? Blood. Because it might contain HIV, HBV and other bloodborne pathogens, right? So depending on specimen. But I tell you, just look at that tube and tell me whether the volume is sufficient or not. And in the urine, I have told you to open the cap and take a lookful of urine. So now which becomes more risky? Urine में भी तो pathogens हो सकते हैं ना, and this I am just telling you, just look at the tube from far away, whether volume is there or not. इतना सा blood निकला है कि ज़्यादा blood निकला है. Understood? Quantity not sufficient. So risk also depends on the procedure you are doing. Understood? Just looking at the tube is not the risk. If I tell you take drop of blood from that tube, then yes, the risk increases. So you have to realize the risk also lies behind what kind of procedure you do. And certain procedures are more risky than others. Understood? So you have to take necessary precautions depending on the agent in question and the procedure you are going to do. How dangerous is the suspected agent you are dealing with and what kind of procedure you are going to do. So what about the agent? What is the agent in question? What are the sources of infection? What are the modes of transmission? Can it cause human infections? And what is the infective dose? Infective dose means minimum amount of that organisms required in that particular specimen to give you the disease. Understood? Some organisms are more infective than the others. Even if you have them in small quantities, you may get the disease. Some organisms, even if you have in large quantities, you may not get the disease because they have higher infective dose. समझ रहे हो? All this will come again in second year, even if you cannot understand for not. So, in a TB hospital versus general hospital, obviously the TB hospital will have more risk. We have a TB hospital at Shivdi. Do you know that? Shivdi TB hospital. You will come to hear about it as you go along. HIV versus HBV. So, HIV से भी ज़्यादा actually dangerous is hepatitis B virus. It has high number of virus per ml of blood, higher viremia. So it is more transmissible. 30% chance of getting HBV if you get a needle stick injury as opposed to 0.3% chance of getting HIV. Understood? But good thing about HBV is that it is vaccine preventable. Have all of you taken HBV vaccine? सब लोग ने लिया है 3 dose? If anyone has not taken, then go to 7th floor new building, meet Sarika ji and take a registration number and take the vaccine from 1st floor immunization OPD. You can do it before you start second year. Okay, 3 doses are must for all healthcare workers. Just check your immunization cards. Some of you might have received it in childhood, then that's fine. Is it clear? Try to get it before you step into the clinical scenario. Swine flu versus seasonal flu. So this is H1N1. Everyone has heard about H1N1 or H5N1. This is swine flu. So as opposed to your influenza A, which is the normal flu, these are newer strains which have got assorted after going into the pigs, that is swine. So we don't have immunity against. Have you heard about Ebola? It is a disease found in Africa, a very dangerous disease. It is more dangerous than COVID. Fortunately, it does not spread by droplet contacts and it spreads by direct contact more. And it did not come outside Africa, thankfully, because of containment measures. Till date, it has not come outside Africa. Understood? It has a very high fatality rate. So you need to be careful. So that doesn't mean that it may never come to India. Understood? All these are known as re-emerging and emerging diseases. Re-emerging means they were there in the past and are coming back after few years of quiet phase. Again you get kind of epidemic of that. And emerging means completely new disease like COVID-19. It was never there in the history of mankind, and in 2019 we got the first case of COVID-19. So that is emerging disease. And re-emerging means there were instances of the infection in the past and now it has come back. Understood? So how does TB spread? Like I said, infected patient from the lungs whenever the patient coughs, sneezes and even talks. So it is always a good idea whenever you are in the OPD, maintain some kind of distance from the patients as well as the relatives. Don't forget this. What happens when we are seeing the patient is coughing. So we keep a distance. But when the relative comes, we will lower the mask and start talking. Kya hua usko, kitne din se, this, that. You have to understand the relative may also be infected because the relative is staying with the patient since a long time. Do you get this point? So you have to think कि मैं mask N95 पहन के ही रखूं if I am in a chest OPD, chest medicine OPD. Understood? Even if the patient I am seeing is not positive for TB, that's fine. I am using up a mask. Do you get this point? But imagine the opposite. Patient is having tuberculosis. I am not wearing the N95 and I am very close to the patient. Then I will get those infections. So you have to overthink कि ज़्यादा protection भी लूँगा तो भी चलेगा, but not the otherwise. So how do infections spread? Either by direct contact or inhalation. Inhalation mostly I told you aerosol, that is tuberculosis, measles, etc. Inoculation means needle stick injury, or even your mosquito bite can inoculate certain organisms, right? Like dengue, malaria. Ingestion means fecal-oral route, that is you will eat contaminated food or water. Who is this scientist? Very famous scientist, Dr. Bruce Banner. Is he a risk? In this form, is he a risk? He is not a risk, right? What about now? Yes, so now the risk increases. So risk depends on the agent in question. What are the agent groups, risk groups? First risk group is, these are the microorganisms which do not cause human diseases. They have a very low risk of causing human diseases. They do not spread into the community. Example is plant pathogen. So you will generally not encounter them. Risk group 2 is the most common kind of pathogens which you will encounter in your clinical practice. That is, they can cause human diseases, but generally these diseases are not serious, can be treated by antibiotics or other drugs. Individual risk is there, moderate risk is there, but community risk is very low. It does not spread fast in the community. Example is Staphylococcus aureus or E. coli. Have you heard Escherichia coli or not? So all these kind of organisms which cause majority of the human diseases. But they are a threat for that individual only and does not spread in the community. Plus they have a decent enough treatment. Understood? So most of the pathogens which you will encounter will be risk group 2. Risk group 3 is, yes, they cause human disease, especially serious respiratory diseases, but they are treatable. And there is also a moderate risk of spreading into community. Classical example of risk group 3 is Mycobacterium tuberculosis, positive organism of tuberculosis, or diphtheria, influenza, etc. and HIV. Understood? So it can spread into the community, be a problem of community level, but you have treatment against it. You have antibiotics against tuberculosis. You have antibiotics against C. diphtheria. Understood? However, the most dangerous is risk group 4. They cause human disease, serious and often fatal diseases and non-treatable. No vaccine, no medication till date has been found. Classical example is Ebola and Marburg viruses. So these have high individual risk and it can spread rapidly into the community as well. So even Marburg cases, some of the cases were found recently in Africa. So you have to take it very seriously, whatever you are going to do from second year onwards. So currently we don't have Ebola Marburg, but we should always be prepared for it. Have you heard this Ebola Marburg? Marburg nahi suna. It had come just a few months back, again in Africa. It's a sister virus of Ebola. Okay. So what are the factors? Personal and procedural factors influencing risk. I'll quickly go through. Immunosuppression means your immunity is less because of, it might be HIV related AIDS, acquired immune deficiency syndrome, or patient having cancer, patient on anti-malignancy drugs, patients on immunosuppressant like steroids. You know about this? Even diabetes mellitus is a immunosuppressive condition, which means the immunity is slightly low than others. Others, like most of us, are immunocompetent. You get this term? Immunocompetent versus immunosuppressed or immunocompromised. Then illness or disease. Pregnancy is a known condition in which immunity is less, and allergies. Okay, so you need to be careful. And then there are certain procedures known as AGPs, that is aerosol generating procedures. As budding clinicians, you should always remember these procedures. Any procedure which is in direct connection with the respiratory tract may generate aerosols. And there, will social distancing help? Will hand hygiene help? It will not. So you need an N95 on whenever you are doing intubation. This is intubation, this is ambu bag, this all will come to you later. Or a bronchoscopy. जो भी तुम्हारा respiratory tract से connect हो रहा है direct, say, let's say there is a road traffic accident just right now outside on the road and patient is brought to the casualty with a breathing difficulty. So you have to secure the airway, you have to do the intubation very fast. Otherwise patient might die. There might be brain damage. Oxygen will not reach the brain. Understood? So you need to intubate. So will you take a sample of the patient, send to the lab, MTB hai kya dekhna hai, and wait for the results and then intubate? You cannot do that, right? So what you need to do, you always need to wear N95 respirator in the casualties and the ICUs. Is this clear? Or whenever you are doing the aerosol generating procedures, you cannot wear a surgical mask. Have you seen surgical mask? When you wear, it is open from the side. So if the patient is MTB positive, you don't know na patient to abhi accident hua hai, you don't know patient is having TB or not, and you are intubating, and you will inhale those particles. Is this clear? Please take this very seriously. Whenever next year onwards, whenever you go for your clinical postings, have a good breakfast and go. Have a good diet and go. Trust me, there are many students, nurses, resident doctors, interns who have got tuberculosis in the past from hospitals like ours and Sion Hospital, etc. You need to take it very seriously. Understood? रात भर नाइट को सीरियल देख रहे हो, कुछ भी कर रहे हो, सुबह जल्दी पहुंचना है पोस्टिंग के लिए या 8 AM लेक्चर के लिए, फिर भी नाश्ता बराबर से करके जाना है, चाहे कुछ भी हो जाए. You can give the excuse. Okay, this is ambu bag. Ambu bag is again for respiration, CPR. Okay, so again some procedures also develop aerosols, but like taking injection, you can see these droplets which are firing, taking injection with a needle syringe, but here the aerosols are likely to be sterile because those injections are sterile. So you are removing them and aerosols are forming, that's fine. But always when you are doing a procedure which will generate aerosols from a patient, you need a N95 on. You need a room with a good ventilation. It cannot be a small cramped up room. with lots of patients and you are doing intubation there, because all the particles will keep on circulating and people will get infected. So it needs a good ventilation. If it is have you heard bronchoscopy? Endoscopy suna hai? That is cameras, using cameras to diagnose or treat. So when it goes into the bronchus, that is the lungs, it is known as bronchoscopy. So whenever you are introducing the bronchoscope in the patient's lungs, aerosols will come out. So your bronchoscopy room should have good ventilation always, and you should always wear a N95. So can you reduce the biohazard risk to zero? No, never. Is there any hospital in this world where biohazard risk is zero? Never. But your goal is to bring it as close to zero as possible. Leave nothing to chance. Understood? So what are the principles of biosafety? It is risk assessment. Risk assessment means what I said, how much of risky the procedure is, who is doing it, is he or she vulnerable, and what is the agent in question. That will be your risk assessment. So depending on that, like I said, intubation is highly risky, I will use an N95. Just looking at the tube and saying what is the volume, then I don't need an N95. You get this point? That is risk assessment. Containment means trying to contain that organism in that particular area where it has leaked. And personal protection, which we had seen in the first lecture. What is biocontainment? It prevents the dissemination of biohazardous agents. Purpose is to reduce or eliminate exposure. Like we had seen with spill. Spill ka yaad hai? Whenever a blood vial falls, what happens? What you will do? ऐसे से झटक के भाग जाना नहीं है. You have to contain it so that it does not spread. Okay? So good practices and procedures. Secondary barrier will be design and engineering controls. This is not in your hands. What is in your hands are good practices and personal protection. Wearing the N95 properly. Even during COVID, what we saw, N95 रहता था किधर इधर गले में. ऐसे इधर लटक रहा है. While seeing the patients and all. This will get, you will get out of jail 90% of that times. But that 10% of the times where you will get infected, you will suffer a lot. Understood? So you have to take 101% precautions so that you don't get infected. So biosafety is application of laboratory practices, procedures plus safety equipments designed to protect human health and prevent release of pathogens in environment. This point also you should remember. खुद को protect किया मतलब environment में जाने दो. ऐसे नहीं करना है. दूसरे को जो होना है होने दो. मैं तो safe हूँ. This happened in COVID. We saw that in first, second wave. Not in the medical community, but बाकी घर में क्या था? अपन safe है, बस हो गया. बाकी दूसरे को कुछ भी हो जाए. So don't do that. Something on respiratory etiquette. क्या होता है इंडिया में? कैसे खांसी करने का कैसे, छींकने का कैसे, वो दिखा रहा है. आज छींक करके सबको देना है, अपना बांटना है ऑर्गेनिज्म. प्यार बढ़ेगा. So no. Understood? So what you need to do is cover your nose and mouth with a single use paper towel or your own handkerchief, or use the corner of your elbow and not your hands. If you are using hands, then you have to do hand hygiene immediately. Understood? And whenever you are coughing and sneezing, wear the mask. That is what actually the surgical mask is meant for, not the N95. You get it? So actually, whenever there is a patient who is coughing or sneezing, give that patient a mask, surgical mask. If you are having sneezing and coughing, best is to not come to the college, and if at all you are coming, then wear the mask. Understood? Surgical mask. Is this clear? And start saying this to those you see on the road spitting. Kuch to sharam. Because in India, anyone is localite. So you come from either Parel or Prabhadevi to the KEM. In that, you will find people spitting at the rate of some 5 spits per minute or more. So, I don't know. And when we ask them in microbiology, we ask them to give sputum. they just give like the thu karke. They give just the saliva, which we don't want. We want the sputum which is in the lungs. And when they spit on the roads, and then they have that nice sputum and spit on the roads. When we actually want the sputum, they don't give to the lab. But on the roads, they will spit like that. I don't know why. So you need to start intervening. What is this? BMW? Everyone knows this BMW. सबको चाहिए ये BMW? हाँ, नहीं चाहिए? अरे बाबा, MBBS का पेड़ा बांटा कि नहीं? MBBS मिल गया सेठ जीएस में. लोगों ने बोला कि नहीं, अरे वाह, अब तक पैसा छापना शुरू हो जाएगा. हाँ, कुछ पैसा छापने नहीं वाले हो. हम लोग अभी तक नहीं छापे. इतने साल हो गए MBBS करके भी. हाँ, so this is the BMW which you want, but for now, what is the BMW you get? Biomedical waste management. हाँ, अपना लक ही खराब है. फिलहाल यही BMW से खुश रहना है. या उल्टा हो गया क्या? देख लूंगा. नेक्स्ट ईयर के लिए चेंज करूं. नहीं, it's there ना, बायोमेडिकल. हाँ, बायोमेडिकल वेस्ट. Biomedical waste and then management. Okay. It's right. So this is, have you started this dissection? अच्छा, अभी तक start नहीं हुआ. Okay. Anyway, you will find this friends of yours in anatomy dissection hall. So you will start doing dissection and then you are going to generate lots of ways. You can see this nice green colored gloves. Can you guess which system has started? Respiratory queue, gastrointestinal. This is all bile and all the whatever, you will encounter it. Okay, this is gloves pack and this is scalpel. Okay. So what does the unwritten law says? Whoever generates the waste, segregation is responsibility of that person. मतलब क्या? जो भी waste बनाएगा वही segregate करेगा. If it is a medical student who has done the procedure and generated waste, who will segregate it? Medical student. If it is the nurse, who will segregate it? Nurse. If it is the ward boy, who will segregate it? Ward boy. If it is the HOD, who will segregate it? HOD. Very good. And that is what the answer I wanted. So it is completely the responsibility of the person who generates it. Don't say कि mama करेगा. Mama means generally we call that for class 4. That it is not their job. Please understand that. This is what we often see. ये क्या कचरे का काम मैं नहीं करूंगा, मामा करेगा. मामा उठाएगा needle syringe, मामा उठाएगा plastic wrapper. No. It is your work. Please understand that. Whenever you become interns or resident doctors, stop saying this. कि मैं नहीं उठाऊंगा ये सब कचरा. It is your job. Segregation. Understood? Segregation means putting it in the right container. Yes, the final what you need to do with that container, that you can assign to a labor staff who will pick up the bag and then discard it wherever required. Understood? But segregation who will do? The person who has generated the waste. So what do you mean by biomedical waste? Bio everyone knows, everyone has taken biology. So bio means of human or animal origin. Medical means not just treatment but also diagnosis, treatment, vaccination, production of biologicals and research. Understood? So any of these procedures you are doing and there is a waste which is generated which is of animal or human in origin, it is known as biomedical waste. Clear? So what it is? What will she say? ये कचरा नहीं है. It has lot of potential. Of what? Causing infections. Very good. What infections we had seen that? HIV, HBV, HCV. This can be and other also antibiotic resistant organisms. So how do you manage? 3 steps. Segregate. Who will segregate it? Person who has generated it, including you. How we will see later. We'll see now. Contain means again keeping it in a container so that it does not spread. And treat means before we give it to a third party, we kind of autoclave it or do other processes so that we safely hand it over to the third party. All this will come to you in second year. Everyone played this during lockdown? Ludo King. हाँ? So Ludo King खेलोगे तो BMW याद रहेगा. What are the colors? Red and yellow for infectious waste, green and blue for non-infectious waste. Understood? This is for Mumbai, okay? Blue and green. Red and yellow is common. So you need to understand, we stick by biomedical waste rules 2016, which are currently going on, means in process, in implementation. So what do you mean by infectious and non-infectious? Anything which will have patient-related thing on it will be infectious, like blood, pus, anything. Understood? Sterile body fluids. Have you heard CSF, cerebrospinal fluid, pleural fluid, etc. And whichever is non-infectious will go in blue and green. So how to remember? Blue is non-infectious dry waste. Okay? Green is non-infectious wet waste, like leftover food material of the patient. Blue में क्या जाएगा? Your plastic, your wrappers, paper wrappers, etc. But not infectious. No blood on it, no pus on it, no nothing. What will go in the red bag is infectious recyclable waste. That is plastic and latex, which has blood on it or was used for some clinical activity, like gloves, etc. Do you get this point? Yellow will be infectious, non-recyclable waste, like anatomical parts. Can you name some anatomical parts which may be found in our hospital? Placenta, very good. So after delivery, you will have placenta. Then after amputation, you will have limbs. Understood? Plus gauze piece which is soaked in blood, pus. These are also non-recyclable. N95, surgical mask. These are non-plastic. This will also go in yellow bag. In red bag, all your plastic gown, plastic UV tubes, IV tubes, IV bottles, Foley's catheter, etc. All you will come to know when you start second year. Is this clear? Only plastic infectious thing which goes in the yellow bag is blood bags. Okay? There is a reason for it. I'll cover later. Okay? So, you have to, everyone is clear? What do you mean by recycle is use it in another form. Whatever plastic you put in the red bag is autoclaved so that all the microorganisms die. Then that plastic is removed and converted into plastic bricks or plastic roads. So that is recycle. What is reuse? Means using it in the same form as it is. That is reuse. Recycle means converting it into another form and using. So how do you categorize? Yellow bag, like I said, human tissues, organs, placenta, everything. And how is the final treatment? That is by incineration. Incineration is bhasma kar dena. Bhasma. Why we need incineration? Like you said, placenta. अपना इधर देखा है कभी? अभी तक गए नहीं होगे डिलीवरी वार्ड में. जाओ. Every few minutes you will hear crying. Some female will start her delivery because of the pain. She will start crying. By the time the intern delivers one baby, the other lady has now started crying. So I say, how many deliveries we get in a day? A lot. So how many placentas will we get in a day? A lot. How many yellow bags will we get in a day? A lot. How many colleges we have or hospitals we have? Sion Hospital. Udhar se bhi aayega sab placenta. KEM se bhi aaya placenta. Nair se bhi aaya. Cooper se bhi aaya. JJ se bhi aaya. What will happen? Nice mountain of placentas. Understood? So what happens when you incinerate? Bhasma. It gets reduced to ash. Volume is reduced. All the microorganisms are dead. Understood? That is why finally the yellow bag gets incinerated. That is the reason why blood bags or blood products like platelets or you will come to know fresh frozen plasma, etc. They are put in the yellow bag because yellow bag is incinerated. What used to happen previously, as per the logic, It is a plastic bag. Blood bags are plastic, right? And they can be infectious. So by logic, it should have gone in red bag. But red bag does not get incinerated. It gets autoclaved, opened, and goes for recycling. So what they used to do when they used to open and they used to find blood bags, they used to take them out and pour in fake blood and sell it. Okay? So to prevent that, NACO, that is National AIDS Control Organization of India, has said that you put it in the yellow bag so that these bags get incinerated and no one can reuse. Will you remember this? Good. Okay. So other things are soiled waste like items contaminated with blood, body fluids, plaster casts, cotton swabs. This will go in the yellow bag. Experimental animals. We have experimental animals. We have an animal house. So mice, rabbit, hamster, you have that. Expired medicines, etc. What will go in? Discarded linen also, if linen gets contaminated with blood or pus. Red bag mein kya jayega? Whatever is plastic and infected, like disposable item like tubings, bottles, that is IV bottles. Don't think any other bottles. IV sets, Foley's catheter, urine bags, syringes without the needles, and gloves. Gloves are latex. They can be recycled. Okay, so plastic gloves or latex gloves. And sharps will go where? First lecture. Sharps container. Puncture proof sharps container. Understood? So this is the puncture proof sharps container. Needle, syringe, scalpel blade, everything else. So that no one gets a prick. And this is mainly for nursing. Whenever you break that ampule, you get that glass ampule that will go in a cardboard box with a blue sticker. Green bag, wet waste like food, and blue bag, dry waste like syringes, wrappers, wrappers of syringes. Okay. अभी तुमको क्या बोलेगे मैं किधर भी डालूंगा इनको क्या पता चलने वाला है क्या फर्क पड़ने वाला है so it's not so it gets detected and if BMC is the Bombay Municipal Corporation or Brihan Mumbai Municipal Corporation, that is our local authority, they can fine you 25,000 for the first instance if they find a wrong thing in the wrong bag. Then they can even arrest. Who will get arrested? कौन क्या बोला? Rashi will get arrested. Okay. So who will get arrested? The administration of this hospital. तो अच्छा है ना डालने का नहीं ऐसे नहीं है. Even the cancellation of license can happen of the institute if on repeated means repeated offense. Understood? So तुम्हारा MBBS डिग्री भूल जाने का अगर कैंसल हो गया लाइसेंस तो ये कौन है कौन था बोलने वाली this is actually this means that you will not go scot free. We do audits of biomedical waste and if we find you this doing something wrong then we can issue memo. Hospital Infection Control Committee can issue a memo to whoever is this Kontha person. So better to err on the side of caution than complacency. What is the message you learned today? Better to whenever it comes to clinical practice, better to err on side of caution than complacency. What does that mean? Suppose I am touching a blood sample without gloves and that patient turns out to be HIV positive, HBV positive. Imagine how dangerous that could be. Whereas I am touching a sample with gloves and patient is HBV negative, HIV negative. It's okay. I just use up one glove. That is fine. Don't play with your lives. Do you get this point? अभी yes करोगे, मुंडी लाओगे, इंटर्न होने के बाद सेम वही चीज करोगे. फिर से, गलत चीजें. Okay? Just last one exercise which we will do is you are going to answer. Okay?